Hi, I'd like to talk to you today about cavities and what is a tooth made up of. Now don't forget, a tooth is made up of enamel, dentin, the nerve, and of course, nice healthy bone. Now what happens if there is a cavity? A cavity is in essence a bacteria, a small single bacteria that starts and leads to proliferation that makes a big cavity. Now cavities can start small. If it's a small cavity, we can either do nothing about it, just follow it up, brush it, change the diet, and it would stop, or we can do a small filling to treat it. Now, if we do nothing about it and the person does not change their diet, their brushing, the cavity becomes medium sized. And when it's medium sized, maybe it's here, it just reaches the dentin layer. And that's when the person starts feeling a little bit sensitivity, a little bit pain on sweets, but nothing major. They sleep at night, everything is good. Now this is a moderate cavity. Again, a dentist takes an x-ray, checks how severe is the cavity, how big is the cavity. The only thing we can do here is a filling. If the cavity is here, and all the surfaces of the tooth, a dentist may opt for a crown. Now what happens if the cavity is not treated, there is no filling, and the bacteria is still very active? What happens next is then it reaches the nerve, and that's when the person or the baby start feeling pain, unable to eat, unable to sleep, and that's when it becomes a big serious problem. Now at this stage, when it comes here, the only thing we can do is a root canal and then put a crown on. But what happens if we still do nothing? The cavity then becomes into infection and reaches the bone, and that's when the tooth has an abscess, becomes super painful on eating and chewing and even touching, and that's when the tooth needs to be extracted. I love your questions very much. Don't forget to keep them coming. Thanks.